Hello, welcome to another one of our Dr. Foot videos. I hope you are all well. I want to talk about a foot condition that I'm seeing an awful lot of, especially in runners and especially when some big races are coming up like marathons and 10Ks. I'm seeing an awful lot of this, and I've seen quite a few patients this week with this particular condition. Let me just finish off my coffee. I was dying for that coffee. I want to talk about capsulitis. Now, the capsulitis and actually I want to talk about two conditions: capsulitis and plantar plate tears. It's all part of a continuum, and let me explain what I'm talking about. So, I'm specifically talking about the second metatarsal. This one here can affect any of the metatarsals, but this is the most common one. The plantar plate connects the head of the metatarsal to your toe. It's a structure like a fibrous structure. I'll show you a short animation of a plantar plate, and you can see how it breaks. But what normally happens is runners complain of pain in the ball of the foot first. There's no specific pathology. It can just be a discomfort. As that discomfort progresses, you get capsulitis. So around the head of the second metatarsal, there is a capsule, and that gets inflamed. If I find that I have a runner or a patient with capsulitis, I tend to inject it, and I tend to get them to wear a special boot for a couple of days just to allow it to heal, and it settles it down really well. If the patient doesn't want an injection, I will give them an orthotic to offload that area, and it will work really, really well. If the capsulitis isn't picked up, and if the runner keeps running on it, then that can lead to a plantar plate tear. As the animation that I showed before, it can actually tear. If it tears, then we can diagnose that in clinic by doing a couple of different clinical tests. So we palpate the region. And I'll show you a separate video where we're looking for a pinpoint tenderness and we're moving along it, and then we're actually applying a stretch to the plantar plate, and we're trying to see if there's excessive movement compared to the other foot or the other toes. If there is, even if there's a couple of millimeters more of movement, that's enough to cause discomfort, and that's enough to cause a problem. So at that stage, if I find a patient who's got a plantar plate tear, I may get them to wear a boot for a much longer period of time, get them to really modify their activities. If you've got a plantar plate tear, you're not running a marathon or a race, you're really resting then. If you don't rest, let me just try and get my words and my thoughts out. If you don't rest, that can lead to a permanent pathology. So you can get an hammer toe, or your toes can spread apart, or they'll go one over the other. It's a permanent pathology. Then you need to have surgery. Then there's nothing that anybody can do apart from a surgeon. So during that stage, you've got a window of opportunity to treat the plantar plate, injury. But I think, because I've had 3 runners in this week who have been at different stages of this continuum. Some have just had bruising, some have had capsulitis, some have had a complete plantar plate rupture. It doesn't get picked up on ultrasound very well, but I can't pick it up, and I've been doing ultrasound for ages. I can't pick it up. I usually send the patient off for an MRI. However, I can normally tell clinically. I can normally palpate, and you just get a feel for the excessive movement in that plantar plate. Now, the plantar plate is a very important structure. The plantar fascia comes under the foot, and it attaches into this flexor apparatus and into the plantar plate. So if you've damaged the plantar plate, you could potentially have other problems in other part of the foot, which I have had when I've had patients who've had damage to the second metatarsal, and then they've had plantar fasciitis. That's 2 specific foot conditions that can take a very long time to heal. So how do we treat this? Well, we can apply taping to the area. There's a specific taping technique. It is pretty good. We want to alter activities, so we want to slow down your running. We may have to find some other form of cardiovascular exercise during this healing period, depending on what stage you are at the continuum. So if it's not too bad, then we don't necessarily have to. We definitely need to change footwear. So we need a stiffer shoe. Often I recommend different types of running shoes and everyday shoes as well. So I mean, a lot of my patients are working in the city, and if they are wearing high heels, or if they're wearing men's shoes that are designer and very tight, that's going to cause a issue with that area, with this area here. Orthotics are really good. So you can offload it with a metatarsal pad underneath there, a metatarsal dome as well. There's some carbon fiber rocker bottom insoles that you can get. There's a podiatrist down south named Nick Knight. He's done a lot of work around plantar plates. He's worth looking up if you're down south. Who really knows his stuff, and he's helped me out loads in the past. But that's the kind of stuff that we do. If I catch the patient, or if I catch the patient, I'm not going to catch the patient. If I diagnose the condition at an earlier stage, and it's capsulitis, and it's not a plantar plate tear, I am inclined to inject it with a steroid and get them in a boot and get them to offload, because it can prevent that continuum and it can prevent any further damage. But generally speaking, we try and offload as much as possible, but diagnosis is key. There are other conditions like bursitis that can happen around the second metatarsal, and other conditions as well, like nerve damage. So go and see a podiatrist. Hope this was interesting, and this is a very vast subject. I see loads of runners with forefoot pain, loads of runners, and it's usually coming up towards a race. They've all got different types of foot conditions, and I manage them all completely differently, because you have to make a treatment plan that's unique to your patient, and it's not one size fits all, because everybody's got different aims. And I've had a ultra marathon runner come in recently who's had capsulitis, and not a plantar plate tear, but had capsulitis, and trying to get him to rest was the hardest thing I've ever done in my life. But yeah, I did manage to calm down the inflammation in that capsule, and he was able to do his ultra marathon. Hope you found this video interesting, and I shall speak to you soon. Take care. Bye.